Dear students, I am Dr. Dharmendra Sharma, Professor, Principal, Dean of the D.Y. Patil Homeopathic Medical College and also the Head of Department of Forensic Medicine. In continuing with Module 1, our third lecture is about consent in medical practice. In this lecture, we are going to discuss a fundamental concept in medical ethics and practice. We will cover in this lecture the definition and importance of consent, the different types of consent, the process obtaining informed consent, legal and ethical considerations, the recent developments and the special considerations for the vulnerable populations. Understanding consent in medical practice is crucial for both legal and ethical reasons, and as we know, our subject is also called as medical jurisprudence. So, medicine is pertaining to medical side, juris is the law and prudentia is the knowledge of. So, medical jurisprudence is the knowledge of medicine and law both. So, there is a legal importance, and in the legal importance we will be studying today the protection against liability. Properly obtaining and documenting consent shields the healthcare providers from legal claims such as malpractice, battery or negligence. Without a valid consent, any medical procedure can be considered as unlawful, leading to potential lawsuits or cases being filed against doctors. Compliance with the laws. Consent is a legal requirement under various national and international regulations. Healthcare providers must adhere to these laws to avoid penalties, professional sanctions or legal actions. Ethical importance. There should be a respect for autonomy. Ethically obtaining consent is a way of respecting a patient's right to make the decisions about their own body and about their own treatment. It acknowledges the patient's liability to make informed choices based on their values and their beliefs. Building trust. The consent process fosters a transparent and a trusting relationship between the patients and the healthcare providers. By ensuring that patients are fully informed, the providers demonstrate respect and care, which is essential for effective treatment and patient satisfaction. Upholding the ethical standards. The consent aligns with the core ethical principles such as beneficence, non-maleficence and justice, which means doing good, avoiding harm and being fair. It ensures that medical interventions are conducted with the patient's best interests in mind. In summary, understanding and properly implementing the consent in medical practice are vital for protecting both the patient's rights and the healthcare provider's legal standing, while also upholding the ethical integrity of the medical profession. So, consent in medical practice is a critical component of the patient caregiver relationship, embodying the principles of respect for autonomy and human dignity. It involves obtaining a patient's voluntary agreement to proceed with a medical intervention after they have been fully informed about the procedure, including its purpose, potential risks, benefits and possible alternatives. This process ensures that the patients are not subjected to medical treatments without their explicit approval, thereby protecting their bodily integrity and personal autonomy. How do we define consent in medical practice? It is a voluntary agreement of the patient to